Hello, and thank you for joining us today for the Medigap versus Medicare Advantage presentation brought to you by the Medicare Medicaid Assistance Program, also known as MAP, through the Area Agency on Aging 1B. My name is Melissa Devine. I am the site coordinator for the Livingston, Washtenaw, and Monroe area, and I'll be talking to you today about Medigap versus Medicare Advantage plans. Let's get started. Today, we're going to learn a little bit about the Medicare Medicaid Assistance Program, or MAP. We're going to learn a little bit on the background of Medicare, what Medigap is, how to buy a Medigap plan, and Medicare Advantage plans. MAP counselors are certified and have been trained in healthcare benefit counseling. This includes Medicare, Medicaid, and other insurance products. MAP counselors are not connected with any insurance company, and they are not licensed to sell insurance. In many states, MAP is called the SHIP program, State Health Insurance Program. We're located all across Michigan, and we offer free health benefit counseling assistance, amongst other items. So what can a MAP counselor help you with? Well, we can help you understand new healthcare options, understand Medicare and Medicaid. We can help compare or enroll in a Medicare prescription drug plan. We can help you review Medicare supplemental insurance needs or Medigap policies. We can help you understand Medicare health plans, apply for Medicaid or the Medicare Savings Program, and of course, identify and report Medicare and Medicaid fraud and scams. Now let's learn a little bit about Medicare. Medicare is health insurance for three groups of people: those that are 65 and older, those under 65 with certain disabilities, and those of any age with end-stage renal disease, or ESRD. It is administered through the Centers for Medicare and Medicaid Services, also known as CMS. Enrollments take place through Social Security for most, and the Railroad Retirement Board for railroad retirees. There are four parts to Medicare: Part A, hospital insurance; Part B, medical insurance; Part C, Medicare Advantage plans, like HMOs and PPOs; and Part D, the Medicare prescription drug coverage. When you first enroll in Medicare and during certain times of the year, you can choose how to get your Medicare coverage. There are two main ways to getting your Medicare coverage. First is Original Medicare. This Original Medicare includes Medicare Part A, hospital insurance, and Medicare Part B, medical insurance. If you want drug coverage, you can then join a separate Medicare drug plan, or Part D. And to help pay your out-of-pocket costs in Original Medicare, like your 20% coinsurance, you can also shop for and buy a supplemental coverage plan, also known as Medigap. This can be used by any doctor or hospital that takes Medicare anywhere in the U.S. Your second option is with Medicare Advantage, also known as Part C. Medicare Advantage is an all-in-one alternative to Original Medicare. These bundled plans include Part A, Part B, and usually Part D. These plans may have a lower out-of-pocket cost than Original Medicare, and in many cases, you will need to use their doctors that are in their plan network. Most plans offer extra benefits that Original Medicare doesn't cover, like dental, vision, hearing, and more. Now we're going to dive a little deeper into Medigap policies, often referred to as Medicare supplemental policies. So what is a Medigap policy? Well, Medigap policies are optional, standardized policies sold by private insurance companies. These must follow certain federal and state laws, and in addition, all plans of the same letter have the same coverage. Only costs are different. Not all plans are offered to people under 65 with a disability, and you must pay a premium in addition to your Medicare Part B premium. You cannot have Medicare Advantage and a Medigap policy at the same time. Medigap plans are standardized plans that cover basic and or additional benefits. The plans are A through D, F, G, and K through N, each with their own set of covered benefits. Starting January 1st, 2020, Medigap plans sold to beneficiaries that are new to Medicare won't be given the option of enrolling in plans C and F. Instead, if you have access to Medicare starting January 1st, 2020 or later, you'll be allowed to enroll in plans D or G instead. The basic level of coverage at minimum covers the Medicare Part A and B coinsurances and copayments, Part A hospice care, and the first 3 pints of blood if a transfusion is needed. Plans that offer coverage of both basic and additional will cover all of the basic plan features and skilled nursing facility care coinsurances, the Part A deductible, and more depending on the plan. Plans with the same letter must provide the same basic benefits. The cost can vary greatly between companies. How premiums are determined may be different. The cost of a policy may vary based on zip code, age and gender, whether you're a tobacco user or not, your health history, the company that's selling the policy, and when you purchase the policy. There are 3 types of pricing methods for Medigap policies. The first is community rated, meaning the price for the monthly premium is the same across the board to every policyholder in a community rated plan, regardless of their age. What that means for you is that the premiums are the same no matter how old you are, and that the premiums may go up because of inflation and other factors. So, for example, Mr. Smith is 65. He buys a Medigap policy and pays a premium of $165 monthly. Mrs. Perez is 72. She buys the same Medigap policy as Mr. Smith. She also pays $165 monthly in her premium because with this type of policy, everyone pays the same price regardless of age. The second pricing method is issue age rated, meaning the monthly premium is based on the age you are when you bought or were issued the Medigap policy. That means that the premiums are lower for younger buyers and won't change as they get older. Premiums may go up only because of inflation and other factors. For example, Mr. Hahn is 65. He buys a Medigap policy and pays a $145 monthly premium. Mrs. Wright is 72. She buys the same Medigap policy as Mr. Hahn, but because she's older at the time she buys it, her monthly premium is $175 per month. The third pricing method is attained age rated, meaning the monthly premium price is based on your current age and the premium goes up as you get older. That means that the premiums are lower for younger buyers and will go up as they get older and eventually can become the most expensive. These premiums may also go up because of inflation and other factors. For example, Mrs. Anderson is 65. She pays a $120 monthly premium. Her premium will go up every year, and by the time that she is age 72, her premium will go up to $165 monthly. Mr. Dodd is age 72. He buys the same Medigap policy as Mrs. Anderson. He pays a $165 monthly premium. His premium is higher than Mrs. Anderson's because it is based on his current age. His premium will also go up every year, and at the age of 74, his premium will go up to $177 monthly. So why buy a Medigap policy? Well, if the monthly premium is affordable, purchasing a Medigap policy can cover the gaps in Medicare coverage, like the Medicare 20% coinsurance. It minimizes out-of-pocket costs by covering coinsurances, co-payments, and deductibles. Medicare supplemental plans provide additional payment coverage options to prevent future catastrophic out-of-pocket costs. So, when's the best time to buy a Medigap policy? When you first become eligible for Medicare Part B. During your Medigap open enrollment period, when purchasing a Medigap policy, the insurance company cannot deny you a Medigap insurance policy. They cannot place conditions on that policy, like making you wait for your coverage to start, and they can't change the price of that Medigap policy because of your past or present health conditions. So when you buy a Medigap policy and you have what's called guarantee issue rights, those are rights that a beneficiary has in certain situations when an insurance company is required by law to sell or offer the policy. In these situations, the insurance company must sell the policy, must cover all pre-existing health conditions, and cannot charge more for a Medigap policy because of past or present health problems. For more information on guarantee issue, please visit medicare.gov/supplements other insurance /when can I buy Medigap. So, how can you buy a Medigap policy? First and foremost, you can contact the plan directly to enroll. MAP can help provide online enrollment assistance for certain plans that offer online enrollment, like AARP United Healthcare, Blue Cross Blue Shield, Priority Health, and Humana. MAP can also provide a Medicare Medigap policy comparison so that you can make the best decision on the Medigap coverage you'd like to enroll in. The Medigap pros and cons. What most people like about Medigap policies is that they're easy to comparison shop. It's mostly all about the price. There's lots of companies to choose from, and you have a nationwide network of providers because you can see anyone who accepts Medicare. Also, these policies minimize and eliminate out-of-pocket expenses that you must pay for your Medicare. Most people don't like that Medigap plans are not easy to change plan letter and or companies after the initial enrollment period. There's no annual open enrollment period, so there is often medical underwriting requirements. In most cases, policies use the attained age-rated premium methodology, which means those premium amounts are subject to annual increases based on age and other factors. And it's an expense. Combined with your Part B and Part D, that means you have 3 separate monthly premiums that must be paid. So what are Medicare Advantage plans? Well, they're the second way to get your Medicare coverage. It's a health plan option approved by Medicare, run by a private insurance company that offers some extra services, including silver sneakers, home health benefits, dental, vision, hearing, and more. Medicare pays an amount for each member's care, and they are another way to get your Medicare coverage. If you join, you are going to have to use their network doctors and hospitals. These plans are often HMOs or PPOs, and they're not available in all areas. If you join a Medicare Advantage plan, you still are in Medicare with all rights and protections. You still get your Medicare Part A and B services. You may have prescription drug coverage included, and again, you may get extra benefits like dental, vision, hearing, and others. You will have to continue to pay your Part B premium, and you may have an additional monthly premium depending on the plan. You can join a Medicare Advantage plan when you first become eligible for Medicare during your initial enrollment period. This begins 3 months immediately before your birth month, the month that you're born, and continues for 3 months after your birth month. You can change your plan during the annual open enrollment period, which is October 15th through December 7th each year, with the coverage beginning January 1st. If you wait until January 1st, you can make a change so long as you're enrolled in a Medicare Advantage plan during the Medicare Advantage open enrollment period, January 1st through March 31st each year. You may be able to join during other special times, and a MAP counselor can help you determine whether you qualify for a special enrollment period. The best way to enroll in a Medicare Advantage plan is by contacting the plan, by calling their number, visiting Medicare.gov, and of course, having a MAP counselor assist you. The best way to look into Medicare Advantage plans is to consult the various resources available to you. This includes the Medicare and You book that you'll receive each year, typically in the fall, utilizing Medicare.gov, by using their plan comparison tool to identify approved plans available in your zip code area, by using the provider website, of course, receiving any counseling assistance from the MAP program, and making sure that your desired healthcare providers are in the Medicare Advantage plan network before enrolling. You can do that by contacting your provider office and contacting the Medicare Advantage plan. So what do people like about Medicare Advantage plans? Well, they like the flexibility to change plans annually without obstacles like medical underwriting. Most of these plans use community rating, thereby removing age as a direct factor in determining their annual premium increases. These can be more affordable, particularly those that are in relatively great health. There's extra benefits such as dental, vision, and hearing available in plans. And there's the simplicity of paying one premium to one single entity. What people don't like about Medicare Advantage plans is the limitation of using network providers. And the annual out-of-pocket expense risk can be several $1,000s. It's also harder to compare shop these than Medigap plans. Well, so the question is, which is better? The answer, it's going to depend on several individual factors, including the geographic mobility, the need to use specific healthcare providers, financial resources, comfort level, out-of-pocket expense risk, and health status. So if you'd like to speak more with a counselor about your specific situation, give MAP a call. We currently are counseling over the phone and virtually face-to-face through Zoom. Our services are confidential and unbiased, and no question is too trivial. We often deal with very complicated questions as well. For more information and help out there, you have resources available through Medicare.gov, Medicare and You Handbook, 1-800-Medicare, and of course, MAP. Give us a call at 1-800-803-7174. That's 1-800-803-7174. If you have any questions, please feel free to reach out to MAP at 1-800-803-7174. That's 1-800-803-7174. Thank you so much for spending your time with me today. We look forward to assisting you further.